Hello everyone, welcome back to my channel. I am Soumya Tiwari and in this video we will be talking about biomechanics of shoulder joint. So you all know that your shoulder complex consists of four joint. Your shoulder complex consists of four joint. First is SC joint, that is sternoclavicular joint. AC joint, acromioclavicular joint. Next is your glenohumeral joint, which you call this shoulder joint. And now next and last is your scapulothoracic joint. So these are the four joint which comes under shoulder complex, and in this video we will be discussing about SC joint. So let's start the video. So let's start this SC joint with their introduction. So SC joint articulation. First we will discuss about the articulation of this joint. So as the name itself suggests that it is an articulation between sternum and the clavicular. So this is your manubrium and this is your medial end of your clavicular, which is articulating with the manubrium sterni of your sternum. So if you see the articulation, so do you say this joint is congruent or incongruent? So this joint is incongruent. Why? Because if you see, only a small part of the medial end is in articulation with the manubrium sterni. So this is basically incongruent joint, not a congruent joint. So it basically is an articulation between clavicle, medial end of the clavicle, your manubrium sterni and your first costal cartilage. So this is all about articulation of sternoclavicular joint. So this is your very important joint. Why I am saying this? Because this sternoclavicular joint is the only joint, remember this, it is the only joint which transfer your weight from your, this is your appendicular structure. So this joint, this is your SC joint, sternoclavicular joint. So it is the only joint which transfer your weight from your appendicular structure to your axial body. So remember this, it's a very important point. SC joint is the only articulation, or it is the only point which transmit your appendicular upper limb weight to your axial skeleton. So we have done its definition, its articulation, and now the next point we are discussing is its type of joint. So which type of joint is sternoclavicular is? So it is a plain synovial joint. It is a plain synovial joint. But if you googled it, you will find this, it is a saddle joint. But why I am saying this is a plain synovial joint? So let's see. So the articular surface of the clavicle is saddle shape. It means it is concavo-convex. So half part of it is convex and half part of it is concave. But if you see this, only a small part of the clavicle is only in articulation with the manubrium sterni. So we consider it is a plain synovial joint, not a saddle joints. So I hope I am clear to all of you. And I forgot to mention one thing, it is a clavicular notch of your manubrium sterni. This is your clavicular notch where clavicle is articulating with. So now Next is your, I have already told you, this is incongruent joint, and if you see the surface area which is in contact is very small, so there must be something which makes this joint the congruent or stable one. So there is a structure, that is your disc. Which structure? A disc. So disc is your fibrocartilaginous structure which is making your joint the congruent one. So if you remember, you have menisci in your knee joint. Remember, you have menisci in your knee joint, and what is its function is, it is there to increase the congruency of the joint. So here is a disc which is fibrocartilaginous structure, and why it is there? So it increases the joint congruency. So we will discuss about its function. What is the function of that disc? So first is congruency. It maintains its congruency. Now, second most important function is your force prevention. So, let's suppose you have hit something. So, let's suppose you have hit something. So, what happened? The force is transmitted from your appendicular structure to your axial body. So, here is your SC joint and here is your disc. So what happened, जो फोर्स है वो यहाँ से ट्रांसमिट होता हुआ आपके एक्सियल बॉडी तक जाएगा. सो इट माइट ऑल्सो बी पॉसिबल कि आपका जो क्लेविकल है, बिकॉज ऑफ द फोर्स विच इज कमिंग फ्रॉम योर लेटरल साइड टू योर मीडियल साइड, तो इट might get chances to dislocate medially. So there is a disc which prevent your your clavicle translation or clavicle dislocation. So if you see the disc, which is your fibrocartilaginous structure, so it is dividing your joint space into two. You can see this is your disc and this is dividing your joint space into two parts. So now next is, we have discussed introduction, its articular surfaces, its joint type, and which structure is helpful in to maintain their congruency. So next we will discussing about their ligament. So there are basically three ligaments which we are going to study. So first is your, it's very easy to remember the name of the ligament. How? So as you know, this is your clavicle, this is your sternum. So this ligament, the ligament here is present a ligament. So this is your sternoclavicular ligament. So the ligament which is connecting your sternum to your clavicle, so this is your sternoclavicular ligament. So let's suppose this is your clavicle. I don't have clavicle now, so let's suppose this pen is your clavicle and we are talking about sternoclavicular ligament. So this is your clavicle and it has two fibers. Sternoclavicular ligament has two fiber, anterior one and your posterior one. So this is your, my hand is your sternoclavicular ligament, this is anterior one and this is posterior one and this is your clavicle. So what is the function of sternoclavicular ligament? So it prevent your anterior and posterior translation. So the function of sternoclavicular ligament is, it prevent your anterior and posterior translation. So remember this, it is very easy to remember. So now the second ligament is your costoclavicular ligament. As I have already told you, the name, the remembering of name is very easy. So this is your first costal cartilage and the ligament which is present here, which is connecting your costal cartilage to your clavicle, is costoclavicular. So here is your costoclavicular ligament. So what is the function? So this ligament prevent your excessive elevation. What is this ligament? Your costoclavicular ligament prevent excessive elevation of your clavicle. So this is its function. So now let's talk about the attachment of this costoclavicular ligament. So if you see this, here is your costoclavicular ligament. So superiorly it is attached to the inferior aspect of your medial end of the clavicle, and inferiorly it is attaching with your first costal cartilage. You can see this. Superiorly it is attaching with your medial end of your clavicle and from your inferior margin, and inferiorly it is attaching with your first costal cartilage to your first rib. So now your third ligament is your, this is your third ligament. So this is your interclavicular ligament. The ligament which is connecting your two, this is your clavicle, is your interclavicular ligament. So what is its function is it prevent the depression of your clavicle. So this is your interclavicular ligament which is preventing your depression of your clavicle. So now talking about the degree of movement, degree of freedom. So your SC joint has 3 degree of freedom. So we are talking about degree of freedom. So there is translatory motion, and there is rotatory. So first we will talking about your translatory. So it has medial and lateral, anterior, posterior, and your superior, inferior. So now next is your rotatory movement, rotatory motion. So it has elevation, depression, your protraction, retraction, and your anterior and posterior rotation. So we are talking about translatory motion, your translatory movement. So if your clavicle moves this side, so this is your medial direction, so this is your medial movement. If your clavicle is moving laterally, so this is your lateral movement. It can move also superiorly, inferiorly, anterior. This is your, if your clavicle moves this, so this is your anterior direction movement, and if it moves this side, so this is your posterior movement. So this is all your translatory movement. So now next we are talking about rotatory movement. So rotatory we have already done. There are 3 movements. So your elevation and depression, your protraction and retraction, and anterior and posterior rotation. So let's talk about first elevation. So as the name itself suggests, elevation, it means upward motion, है ना, superior motion. So this elevation is happens at your lateral end of your clavicle. Let's suppose this is your clavicle. Suppose this is your clavicle and this is your manubrium sterni. This is concave in structure. So this is your manubrium sterni and this is your clavicle. So this is your medial end of your clavicle and your elevation is happens at your lateral end. So this is your elevation. This is your elevation. So if it moves superiorly, so this is your elevation. So what happened here? It applies arthrokinematics rules. So what happened if your articular surface is concave and your जो other surface is your convex. So if convex is moving on your concave structure, so your rolling and gliding will be in opposite direction. Remember this. If your convex, this is your convex and this is your concave, so if your concave is moving on convex, if your convex, this is your convex and this is your concave, so if your convex is moving on concave, so your sliding, gliding and your rolling, there is three phenomena. So rolling and gliding will be in opposite direction, in opposite direction. So this is your clavicle, this is your manubrium sterni, your concave structure, this is your convex structure, your medial end of your clavicle. So its elevation. So see here, your medial end of your clavicle, see this side. So what happen if your clavicle is elevating? So the glide, this is your glide, this is, so glide will be in inferior direction, that's why your clavicle is elevating. So your elevation, that is your rolling, will be in superior direction and your gliding, this is your gliding, so gliding will be in inferior direction. I hope I am clear to you. So in elevation, your rolling is in which direction? Your superior direction, and your gliding is in inferior direction. So next is your depression. So in depression, what happened? So your clavicle is moving downward, है ना, in downward direction. So what happened if your clavicle, this is your clavicle, so if it will move downward in depression, so what happened? The rolling is in inferior direction, rolling is in inferior direction and your gliding is in superior direction. See this is your manubrium sterni and your convex medial. And so if your depression occur, moving of your clavicle in downward, so which glide is there? Superior glide, that's why your clavicle is moving downward. So it means in depression there is rolling is in inferior direction and your gliding will be in superior direction. So now your elevation and depression is occur in which plane? So it happens in your frontal plane. So now next movement is your protraction and your retraction. So this is just opposite of this. Why I am saying this? So first let's talk about this protraction and retraction of your clavicle is occur in which plane? So it occurs in transverse plane. In which plane? In transverse plane. So now what happened in protraction and retraction? So protraction is your clavicle is moving forward and retraction means your clavicle is moving backward in posterior direction. So what happened in this? Your clavicle, I have already told you in elevation and depression that it is your convex part, but in protraction and retraction your clavicle concave part of your clavicle is moving on your convex part of your manubrium sterni. This is just opposite of elevation and depression. In depression and elevation, what happened? Your convex part of your clavicle is moving on your concave part, so the rolling and gliding occurs in opposite direction. But what happened in protraction and retraction? Your concave part of your clavicle, is moving on your convex part of your manubrium sterni. So if your your concave is moving on your convex, so your gliding and your rolling will occur in same direction. This is arthrokinematics rule. So in protraction and retraction, gliding and your rolling will occur in same direction. Why? Because your concave part of your clavicle is moving on your convex part of your manubrium sterni. So in my earlier discussion, I have told you, I have mentioned that the articular surface is saddle shape. It means it has both concave and convex. So your in protraction and retraction, your concave part of your clavicle is moving on your convex part of your manubrium sterni. So don't be confused in this from where convex and concave is coming. So to remember this, or to made it simplify or easier, you must be knowing about your orthokinematics and osteokinematics. So from my side, I am trying to make you clear. So in protraction and retraction, the glide and your slide or rolling is in anterior direction, and the matlab if the gliding and sliding is in interior direction, so the rolling must be is also in anterior direction. So it will be in the same direction. So your next rotation is your anterior and your posterior rotation. So this is your spinning movement. It means the clavicle, this is your clavicle, let's suppose, so it is moving anteriorly or posteriorly. So this is your spinning movement. So let's talk about the range of motion of elevation and depression. So your elevation range of motion is 40 to 45 degree. Your depression is your 0 to 10 degree. Your protraction and your retraction, so protraction is your 15 to 20 degree, and your retraction range of motion is your 20 to 30 degree. Now last is your anterior and posterior. So anterior is your less than 10 degree, and your posterior movement is your posterior rotation is your 50 degree. So let's suppose this is your clavicle and this is your disc, which is fibrocartilaginous structure. So if your clavicle is moving in elevation direction and in your depression, so your disc is stable, it's not moving. So if elevation and depression occur, so the disc considered to be a part of your manubrium, because your manubrium is not moving. So if elevation and depression occur, so the disc is not moving, so it considered to be a part of your manubrium sterni. So if the protraction and retraction occur, so what happen if protraction, this is a protraction moving your clavicle in anterior and posterior direction. So protraction, this is a protraction. So if protraction occur, the clavicle is considered to be a part of the disc is considered to be a part of your clavicle. Why? Because if your clavicle is moving, your disc is also moving, it is not stable. So if your protraction and retraction occur, the disc is considered to be a part of your clavicle because it is moving. So now next and last is your blood supply of your SC joint and your nerve supply of your SC joint. So blood supply is by internal thoracic artery, by your internal thoracic artery and your suprascapular artery, and your nerve supply is by medial suprascapular nerve. Your nerve supply of your SC joint is by medial suprascapular nerve. So this is all about your SC joint. I hope I am clear to all of you, and thanks for watching.